It's awesome. It's been super nice since we've been down here. Little windy, but hey, I will take that in 80 degrees any day over zero.
It took Rita Bishop and her husband Dean 3 tries to reach their favorite destination.
We tried to go last August, but the borders to Belize hadn't opened up yet, so they didn't actually start letting people back in until October 1st. The second time was in November. We tried to come down, and my husband ended up getting COVID, so we had to cancel that trip. So we considered this hopefully being third time the charm.
The Bishops are a little bit different kind of traveler. Rita works for Billings Clinic, so she's already been vaccinated. And as you just heard, her husband has already recovered from COVID-19. And they own the condo they're going to visit. Despite all of this, the Centers for Disease Control and Prevention recommends not traveling.
If people make a different choice, they need to understand the risks that they're taking. And they need to be prepared to what they would do if one of their family members or they get sick.
Nancy Iverson, Director of Patient Safety and Infection Control at Billings Clinic, says when people ask her opinion, she says delay travel. But she also understands the lure.
They have reasons. Their children are getting married, or there's grandchildren or children being born. There's real reasons, and for those situations, you just need to understand your risk and how to minimize and reduce your risk.
Flying was actually great. When we went from Billings to Denver, I didn't have anyone else on the row with me.
So if you choose to buy the ticket and board the plane for paradise, work, or family, the top priority is planning.
Before you leave home, you need to know what the country requires. But we had to go get tested because we had to have a negative COVID test within 72 hours of entering the border of Belize.
The Bishops have studied the do's and don'ts, and it's not a simple list.
We had done our due diligence and downloaded the app that we needed to prior to coming into the country. We had to fill out a whole bunch of questions to make sure that you were going to be allowed to come in.
You have to assume everybody around you is positive. I would wipe all the surfaces that you would touch. I would have eyewear on. I would have my mask on.
Before you fly anywhere, Iverson says study the CDC guidelines. Truly learn how to wash your hands correctly. Do not touch your face. Have disinfectant wipes and extra hand sanitizer, at least 60% alcohol, always within reach. Pack extra masks and learn how to properly fit them. Purchase approved eyewear to protect your mucous membranes and wear them. And keep interactions brief.
Most people think this is 6 feet. That's 2 of my arms is 6 feet. So you want 6 feet between you at a minimum, and really try to not interact with people outside your household.
Travelers need to be aware, do their homework, and have a mindset of safety, because that lure to get away.
It's kind of relaxing and hitting the beach a lot more and just having a lot of warm fun.
Could end up much more complicated than just boarding your flight. In Billings, Janelle Slade, MTN News.